morning. New do today. I look like a Indian warrior.
Pocahontas?
Pocahontas. It is Wednesday, January 11th, and I'm about to get my biopsy. So you think it's gonna hurt?
It's probably gonna hurt a little, but you'll be fine.
Alright, I'll let you guys know what it's like after, if I'm not too broken. Good morning. Today is the first day of chemo. Ugh, I never thought I'd ever say that again, but we gotta do what we gotta do, right? Gotta get this out of my lungs. Anyways, it's breakfast time, and look what the hospital has prepared for me. Beautiful, fancy meal of one piece of toast. Not impressed. But luckily, I have amazing friends and family who brought me some fuel, green juice, still got some fruits, shout out to Miyuki Crochet, and leftover edible arrangements. This was from Tara. There was a lot more fruits around it, but we ate them all. Or we ate them all. Before chemo begins, yesterday I didn't have time to tell you about my biopsy. I don't have the time, nor was I in the mood, so as I sip on my green juice and eat my breakfast this morning, I thought I wanted to let you know what a lung biopsy is like. Yesterday, finally, as you know, my biopsy was finally scheduled. We were super happy about that because there was some confusion with the departments, and I stayed at the hospital the entire weekend and the Monday and the Tuesday hoping we were going to do the biopsy, but it was never done. And as you know, we can only really treat the cancer if we have the results of the biopsy. So without the biopsy, we don't know what this cancer is. What is it like? Well, first of all, they freeze you. This is where they did it for me. And don't forget that it's really different for everybody, because prior to doing my biopsy, I spoke to another 24-year-old Chloe who had a breast metastasis to the lungs as well, like a couple of weeks ago. I know, super strange. She's also from Montreal. Like, I met her. They went from her back. Some people say that they go from the side, but for me, the nodule that was easiest and safest to take was here. They freeze you locally, so you're not asleep when it happens, which is kind of scary, but at the same time, there are less risks and complications. There's more risks and complications if you are asleep, so it's better that you're awake, despite how scary it could be. Then it's done in the CT scan. So that's how they see inside your lungs, and they know where to go get a piece of your nodules. So yeah, so you go in the CT scan, they check, they prick you like 6 times to freeze you, and I think that's probably the most painful part because it stings. Picture going to the dentist and getting your teeth frozen, your mouth frozen. You know, that sharp pain of the needle, and then that burning sensation. That happened about 5 or 6 times until I was fully frozen. And then he sticks, like, it's almost like he stabs you with like this tube thing. And then that goes all the way down into your lungs. You feel pressure, but you don't feel pain. You're not supposed to feel pain, just pressure. And then after that, he sticks the needle in, which then gets the specimen, and then he pulls it out, and it makes a big clap. So don't be scared about that either. And then after that, he pulls everything out. You go back into the CT scan, they check everything out. He makes sure you're okay. And he mentioned prior to doing this that there are 2 risks. One, which is quite common but not as alarming, is bleeding. So he told me if I come out coughing and there's blood that comes out, don't worry, it's normal. We'll clean you up and the lung will heal itself, and there shouldn't be much complications. A second risk was for the lung to collapse, and should the lung collapse, then they would insert this tube for the valve and then to help me breathe, and then you would heal in 2 days or so. I don't know the details because I was kind of like, la, 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 la. I did not want to hear too much about it because he said 1 out of 5 of his patients has their lung collapse. So I was just like, okay, shut up, let's do this. But luckily I did not have any complications. This is my little wound from the biopsy itself. I'm not in pain. It was yesterday. And that's it. That was the biopsy. It was really nerve-wracking. But one thing that was the most nerve-wracking of all was I was in the CT scan, right? And there's like this big screen that the doctor looks at to make sure he can see inside. He knows where to get the specimen. And I kind of turned my head and I finally saw my scan for the first time. My oncologist said that my lungs were covered and there's lots and lots and lots and lots and lots of nodules everywhere. He wasn't lying. I saw the scan and it scared the shit out of me. My lungs are covered with cancer. That really was a big shock to me. Now it is chemo day. If you're still on this journey with me, don't forget to subscribe, send me a comment below. I don't even know what to say anymore. Be patient, be kind to yourself. See you soon.